The title of this is Look Fabulous, Not Fake, which is sort of my mantra, because in cosmetic you will get a lot of people that just look done. And that's not my style. Everybody has their own personal style. Some people like to be over the top. They like people knowing that they had their lips plumped up. They like knowing that they've got the peaked brows from Botox. They want the drama. I'm not a drama kind of guy. And I don't think that most people want that look. The majority of my patients are moms, their daughters, their sisters, their aunts, their grandmas. They're not actresses, they're not runway models, they're not the people that really need to be out in the public eye and look a certain look. I get a few of those, but for the most part, I have the average individual come in and just want it. There goes the lights. I don't think we'll bother again. I think it's just off for good. So really the goal is to get you back to a more refreshed, youthful, rested version of you, not a different version of you. So my office is in Brampton at 410 in Beauvard, Trinity Common, lots of free parking, which is a big deal. Everybody can't stand paying for parking. I know it drives me crazy. So you can also do some shopping while you're there. It's very important that you define your goals. Patients will come in all the time and they'll come in the first time really not knowing what to expect of the whole cosmetic approach, what the options are, what's right for them. And so sometimes they may think that they need to look younger. They'll say, well, can you get me a look 15 years younger? And I usually try to approach it as you want to look better. And a lot of patients don't like it when I say this in the exact sentence, but you want to look good for your age, right? You want to be 40, 50, and people say, oh my God, I can't believe you're 40, you look amazing. Sort of implies that at 40 you shouldn't look amazing, but you know what I'm saying. People want to go to their friends, go to their workplace, and people all say, man, you always look so rested. You always look so refreshed as opposed to you look tired. Right? So when you're 45 and you're trying to look 25, you will look done. Right? Instead, try to look like a good 45. It's very important to have realistic expectations. In this industry especially, there is a lot of hype. There's a lot of untruths, I suppose, that can be said. And people sometimes buy into it and they think, okay, well, can I get rid of those lines? No, you can't get rid of them. Well, can I get rid of those lines? No, I can't get rid of them. And you say the same thing over again because in their mind they heard that they could get rid of those lines. Or they will be able to get down to a size 4 with a certain laser machine. Or they can have the skin of a 6-year-old with a cream. And if it sounds too good to be true, it probably is too good to be true. So you need to be able to trust the person that's talking to you to set a realistic expectation. Then you won't be disappointed. Once again, if you are 60 and someone says, oh, I can get you a look 25, then you know that these are people that are probably not being completely forthcoming with you. Aging. What contributes to aging? Well, first one's what we call intrinsic. Genetics, right? Who your parents are. It's often important to look at your parents and you get an idea of what your skin's going to look like down the road. My mother is 79 and looks amazing. My father doesn't have quite the same luck with his skin, and I, of course, get my father's genetics. So I have to use the Botox and the Restylane to look like my mother. Time, of course, has an effect, right? Can't turn back the clock. And again, if we try to, it's not going to look right. Then there's things we can do, which we call extrinsic factors. Smoking, obviously. A lot of people are not aware that smoking will damage the skin equally as sun. Okay? So people think, well, I'm not in the sun. Well, you smoke, and that's just as much damage to the skin. The other benefit, of course, of quitting smoking, to your pocketbook, you'll save $3,000 a year. You'll reduce your risk of lung cancer, breast cancer, all the other nasty stuff. So there's a lot of reasons to quit smoking. Too much sun exposure, obviously, especially in lighter skin. I have a little bit more protection than someone that is Irish. So you always want to be careful to not have even just one bad burn is enough to cause significant age spots that are very, very difficult to get rid of down the road. Lifestyle and stress, everybody knows that, right? Someone goes through a stressful procedure, a divorce, a death in the family, and they age in 6 months, they've aged 10 years. Okay? And the standard medical approach is, oh, no, stress doesn't do anything. Well, stress kills you. We know this, right? So obviously, try to prevent, and if you can't prevent, then we can move on to some treatments that will improve you. Very important to find the right doctor, okay? And the first thing is, you see there is the internet is not a doctor. I love the internet. The internet's fantastic. I use it for everything, and I actually am happy that patients use it before they come see me. Saying that, they'll often come in with half-truths, misguided information, and so the 10 minutes I was hoping to save explaining to something is 10 minutes spent on undoing what someone else told them, and if it's on the internet, it's true, because no one lies on the internet, right? So anything that they read online, they come in with a preconceived notion. So the internet is a valuable place to get information. Most useful places are the company websites because by law, they are mandated for accurate information. They cannot lie to you on that website. Okay? You can get some blogs, you have no idea who's writing, you don't know if there's an agenda, but you'll also get some useful ones where people are fairly honest and straightforward without a specific agenda. So use the internet carefully. Very important to find a physician that you are comfortable with. Personalities are different, right? You may just meet somebody and say, I don't like them. I don't really know why, I just don't like them. And I don't want to trust my face to someone I don't like. And there will be other people saying, no, I felt this immediate connection. And that's very important. That's your gut feeling, that's your intuition. And don't ignore your intuition. Okay? Your intuition is usually right. Make sure that they're listening to you. Make sure that they understand you, that they're hearing you. They understand what your concerns are. They don't want to placate you, they don't want to tell you things just to make you happy, but you do want to make sure they've heard your concerns. You want to make sure that they're knowledgeable, that they've had proper training, that they're continuing to get further seminars and they're what we call continuing medical education. There's always learning. I've been doing this for years. I train doctors across Canada. I train for the company. I inject people at the company. And you're still always learning. Anyone that thinks that they are beyond the learning stage has gotten a little bit too proud of themselves. Okay? So you always have to make sure that people are continuing to improve their skills. The way I inject today is different than the way I injected 3 years ago. All right? So there's always an evolution. There's always a knowledge to be gained. Experience. And the other one's artistry. A lot of people will come to me and say, well, why are you so many dollars a unit for Botox when I can get for $7? Why should I pay that for Restylane instead of $400? Well, there's an artistic component to it. You are not buying a syringe of Restylane. You are not buying a unit of Botox. You're buying a procedure. You're buying a craft. You're buying a sculpting. And that's very important to understand, especially with the fillers. You truly are sculpting with the fillers, and you want to know that somebody's got the artistic eye, that they understand shadows and angles. And when I train doctors, I know this one's got it. They understand the art of it, and the other, you can teach them till you're blue in the face, but they just don't get it. The analogy I make is if you want to just go by an instrument, a device, if you let me play a piano, you will think the piano is the worst instrument created on the planet. You let my son play it, it's a wonderful experience. And it's the same thing with Botox and Restylane. It's not bad Botox, it's not bad Restylane. It's bad injection technique, it's poor selection criteria, it's inexperience, many variables. So when you hear the horror stories, you see the horror stories, it's not the product, it's the way the product was delivered. Commonly, patients will come in and say, what do I need? Right? What do I need? I say, well, first you need food and then you need shelter. Maslow's hierarchy of needs. Everything above that is extra. So the question is, what do you want? What is it that when you look in the mirror will make you feel better about who you are and where you are in your state right now? Now let's deal with some of the actual things we can do. Okay? So these are some of the common areas that patients will come in, men and women alike. People think that's only women that come in, but we're getting a lot more men coming in. One is wrinkles and folds, and the general approach to wrinkles and folds is Botox and Restylane, which is a hyaluronic acid filler, which we'll explain in a second. Then there's a concern about skin texture, laxity, color, pore size, things like melasma, where women get the hyperpigmentation, especially after birth control or pregnancy. And for that, you have different treatments. You can do Fraxel, which is a laser rejuvenation. You use Maximus, which is a radiofrequency device. Skincare products and cosmeceuticals work very well. We'll discuss those in a second. Then there's fat and cellulite, and unfortunately there is nothing like diet and exercise. I hate to be the bearer of bad news. There are things we can use on top of that, such as the Maximus to help contour, but nothing will replace diet and exercise. And then there's hair removal. And why do I bring hair removal in at this stage? You'll understand at the end, because this is about aging. So we'll discuss that when we get to hair removal. So wrinkles and folds. Common question I get is, what is the difference between Botox and Restylane? After doing this, thousands of injections, thousands of syringes, thousands of balls of Botox, what's the difference between Botox and Restylane? Restylane is a filler. Okay? So the easiest way to think of that is the olden days where there was collagen. You plump up the lips like Goldie Hawn did in First Wives Club, or whatever that movie is called. And nowadays we use it for filling any area. So we augment cheeks, we lift up the cheeks, we improve the folds, we do the lips, we do the hollows of the cheeks, we do the jowls, we do the chin. So anywhere we want to plump things up, that's where we use Restylane. Botox is a muscle relaxant, so it's for dynamic wrinkles that come when you frown, when you smile, when you animate. When those muscles are moving, that's where we use Botox, to stop the muscles from moving and therefore not creating any lines. So Botox has been around for over 30 years, and the safety record is phenomenal. People often will come into my office with a preconceived notion, oh no, I don't want Botox. And you're not trying to push them to do Botox, but often it's a misunderstanding of what Botox does. And when you explain to them that Botox is a purified protein that relaxes muscle action, takes 4 to 10 days to kick in, lasts 3 to 4 months, and has no long-term potential complications. Okay? Then they start to think, okay, well, I'm willing to listen. Then you tell them that 1 bottle of aspirin would kill them. Okay? You open up a bottle of aspirin, take it at one time, that will kill you. Liver failure, kidney failure, you will die. It would take 35 bottles of Botox injected directly into one of your major veins to have a 50% chance of being fatal. Okay? So the safety profile of Botox is far greater than most medications that people use on a day-to-day basis. Botox is used mostly for what we call the glabella, which is the frown lines up here, and the smile lines. We can use it in other areas. I'm going to show you some pictures in a second, but we can use it down in the chin. We can use it down to reduce the marionette lines. And on average, it will last 3 to 4 months. The longer you do it, the longer it lasts. So people that have been with me for 6, 7, 8 years, they'll find that, oh, you know what, I'm not coming in 3 times a year anymore. I'm coming in once a year or twice a year, because they're getting long-term benefit. You actually retrain the muscle, so you stop doing that action because you're not able to do it. When you combine it with Restylane, you'll get an even better benefit. So people will often say, well, you know what? Which one's better, Restylane or Botox? There's no one better than the other. They work differently, they do different things. When you combine them, you get an even better result. So this is a typical situation of frown lines. Okay? I can't do it because I got a bit of Botox into me. But, you know, you can see that it still looks fairly natural. All of my staff have Botox, you can never tell. And that's a very big thing. Patients that walk into the office and say, I don't want to look fake. I'll say, well, all of my staff have Botox. I say, really? I can't tell. They still move. They still express themselves. Yes. Again, Botox is an issue of dosing. You want a little bit of a benefit, you do a little bit. You want a frozen look, you do a lot. I don't do that, but that's how Botox works. The more you put, the more done you will look. So this woman is frowning in both pictures. You'll say, well, she's not frowning in that picture on the right. Yes, she is. I apologize. I don't think it's really coming out well, is it? You can see okay? All right. And the important part about this picture is you still see that line. Okay? You still see this line right here. Now that line was treated both with Botox to reduce the muscle action and also Restylane. We filled her. It brings a very good point that if that line is too deep, if you wait too long, we cannot get rid of it. Okay? So you want to make sure that you're getting it before it becomes a permanent issue. We started her at the age of 26. People say, are you crazy? Why would you start somebody so young? Well, one, she worked at the office. But two, if you look at her mother, she's got a very deep line that we cannot get rid of. So we do her once a year just to prevent her from getting worse. And if you notice, even at the age of 26, there's still a tiny bit of a residual line, even with Botox. And if we didn't do the Botox, she would get worse and worse and worse. This is the crow's feet. Again, a lot of patients have these smile lines. Starts to look a little, a little mature for their liking, and you can get rid of them very nicely with Botox. And yes, she is smiling in that picture. This lady was a very interesting case. She was done by all the top injections across Canada and sent to me. And the reason that I find this one so interesting is everybody in the past used to treat her frontal muscles. I'll show you up here. So everybody used to treat these frontal lines because she didn't like them. Well, those frontal lines, while they may be somewhat unsightly if you don't like them, are responsible for lifting your eyebrow and eyelid. And if you look over here, she's got a bit of a weak eyelid, right? She's got a bit of a droop. So if you Botox this line up here, you won't allow that muscle to lift up. So she'll continue with the droop. So I treated her just around the eyes and around the number 11, and look at the extent of lift she got. Okay? That's almost as good as a surgical procedure, really. She got a significant lift just with Botox. Now, she's still got these lines, but you know what? You can't have it both ways. You can't get rid of both. We also use Botox for shaping. So if you look here, it's a squared off jaw. It's a fairly masculine look. And then we give a nice soft look, okay? More feminized appearance to the lower face. Same thing here, okay? Squared off jaw, down around here, and then a little bit of softening just with some Botox alone. For patients that have TMJ or grinding or bruxism, they're cracking their teeth, they're using a night guard, Botox works beautifully. And in a lot of cases, the insurance companies will pay for it because it's a medical procedure. Same with migraines. We use Botox for migraines. We use Botox for sweating. A lot of times, all covered by your insurance. This is one of the nurses that works at Botox, and if you take a look here, look at how she started with the eyelid, right? This is a year later after doing Botox. This is 3 years later, so she's 3 years older, and look how much of a lift she got, just with Botox. Restylane Perlane, I don't know if any of you attended my demonstration earlier today, but it's basically hyaluronic acid, which is the same compound in your skin that holds water and plumps things up. Hydrates the skin, lifts and fills, and improves the deflation that's occurring as we age. Most common areas are the cheeks, the folds from the nose down to the mouth, the chin, the jowls. So those are all the different areas we can treat. Now in the olden days, we used to treat these folds just by treating those lines, okay? And if you see, you did fill in the line, but she really doesn't necessarily look that much better, right? Here, this one is actually quite a significant difference. You can see just from treating the lines, it's an improvement. And as well here, treated the lines, but unfortunately, still not a really nice change to the face because she's got no significant cheeks here. So we do what's now called volumetric restoration. This is my little guy at the age of 7, okay? And you can see how deep this kid's folds are. And no, I haven't treated him in case any of you are aware. I know, you're all whispering, he didn't treat him, did he? Although he does want me to get rid of that mole, but I don't want to. So you can see how deep those folds are. 7 years old. Why is it cute when you're 7? Why is it not cute when you're 37 or 47? Because the cheeks are way up here, right? Now, this is a rarely seen picture of Brad, and you can see prior to treatment how deflated the cheeks are looking, okay? And this is now 3 years later. This picture is 3 years older than that, and that's about 9 syringes of Perlane in the cheeks. Haven't had it done in about 3 years, so I gotta get on it. This is Linda, my assistant at the office. And if you notice, she's got sort of a flat looking cheek there, a little bit of jowling going on here. Then you just fill a little bit into the cheek, a little bit into the jawline. Very natural look, very soft, nothing fake, nothing phony, nothing over the top. Here's sort of a global face approach, right? You can see how tired the eyes look there, a little bit hollow here, lines here, 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 and here. This is immediately after. So you see a little less tired looking here. The bags even look better, and we haven't even treated that area. Over here, lines are improved, lines down here are improved. All within 45 minutes. Here's a great example done as a split face. So this side was not treated, for those of you that couldn't tell. Cheek was falling, nasolabial fold fairly prominent. This side was treated, cheek was lifted, fold was filled in. So it gives you an idea of the kind of result you get. Lips. Oh, sir, is there a question? Is there a question? No? Okay. Lips, again, you can go crazy with lips and do them over the top, which is not my style, but you can also have a very soft look to the lips. This lady, just again, down in this area here, the marionette lines, and then we just filled them in, okay? She needed her cheek done, but she didn't want to have them done. Now this is another area that we're doing recently, which is the temporal wasting. Now that can happen just because we age, and as well it can happen with repeated Botox in the crow's feet, where you can get a little bit of wasting of the temples, and people get migraine treatment. The muscle itself starts to shrink. Okay? So the temporal muscle here, which we actually treat with Botox for migraines. So when you're using a lot of Botox in there over the years, the muscle can actually start to shrink in response to the Botox, and it'll also hollow out from weight loss and just from aging. So you can see how hollow she's looking on the sides there. Okay? And same thing here. You can see the hollowness on that side, and that's after treatment. We filled that in. Again, I don't know if the lighting's as good as I'd like it to be, but you can see this area. You can even see the shadow in the light reflex. And then look at that, completely filled in. And it's a really nice effect, because a lot of people don't realize that the temporal hollows make one look significantly older than they are. Just be careful who you go to. Experience is probably the single most important factor when it comes to the fillers. Whether it's Restylane, Juvederm, Teosyal, Estalis, Sculptra, you name it. You want someone that's done thousands of injections, not that learned last weekend, okay? And you don't want price to be your determinant, because that was her determinant. And she was in my office in tears because she wanted to get rid of that swelling. Again, I don't know if the lighting is very good here, but she was injected with what she thought was Restylane. We don't even know if it was, because there is a black market of fillers out there, which a lot of people aren't aware of. And she swelled right under her eye, both eyes, completely swollen. It took me 4 weeks to try and break that down. Yep. She spent a lot more money breaking it down than she would have if she didn't go to an experienced injector. That's fillers and Botox. Any questions about those before we move on to skin? Yes? Question was, since Botox only lasts 3 to 4 months, but fillers last 6 to 12 months, how do you sort of get them working together? What you will usually do is you'll do your filler and Botox at the same time, or sometimes you'll do your Botox a week or two before you do your filler to see how the Botox has affected the face. Then, since the Botox lasts 3 to 4 months, you just let the patient know that between now and the time you're going to need more filler, you're just going to touch up your Botox. So you come in January and you do your Botox and your Restylane, and then by May or late April, you're in just for your Botox. You may at that time say, you know what, I wouldn't mind a little more Restylane though. With Botox, if you do too much, you do have a bit of a done look. With Restylane, it's one of those things, the more you do, within reason of course, the nicer it generally looks. So skin concerns, okay? So a lot of the concerns will be just in the skin quality, the pores, the color, all those things. You have a lot of different options. One is some Fraxel, which is a laser treatment, Maximus, which is a radiofrequency treatment, the cosmeceuticals, you can use intense pulsed light, you can do chemical peels and facials, and again, they all add a different piece to the puzzle of correction. Fraxel is FDA approved for fine wrinkles around the eyes, for age spots, and for melasma and acne scars. Now, I use it as well for stretch marks. This is a lady who weighed about 100 pounds, had 4 children with significant stretch marks to just below the top of her bottom of her rib cage. And you can see after treatment a significant improvement. Can't get rid of them with stretch marks or scars. You can never get rid of the scar completely. But if you look at that, again, don't know how the lighting shows where you're sitting, but that's at least a 50% improvement in the scar. Once again, a realistic expectation. If a patient says, well, that's not good enough for me, I want them gone, then you would say, don't even start, because you won't be happy. You really need to understand that's about as good as we can get. Acne scars, okay. Now, acne scars on brown skin are especially difficult to do because of the risk of hyperpigmentation. White skin is much easier to treat with lasers than dark skin. But again, I think that that's a fairly nice result compared to before. And this is 3 treatments of Fraxel. Yes, question. Do I use anything besides Fraxel for scars? Yes, I actually will inject Restylane underneath the scar to prop it up. We'll combine it with chemical peels. We use the Maximus radio frequency. So a combination treatment will give you the best results. Yes? That would cost, well, it was a limited area. It wasn't a full face. If you're doing a full face, 3 treatments would cost $2,500. In that case, I think it was $900 because it was a small limited area. Okay. This is a surgical scar. It's a patient who'd had multiple reconstructive surgeries on the chest wall. And you can see this is a raised, angry-looking scar. That's 1 treatment of Fraxel. And it really flattened that scar out. So people coming in for gallbladder scars, C-section scars, hysterectomy scars, works very well. Women postpartum, helps to improve the stretch marks. Yes, question? Fraxel is a laser. Okay? The difference is that the term Fraxel comes from what we call fractionated laser. So if you think of standard laser as being a sheet of laser light, quote unquote, burning the top, which is what people like to think of laser as, well, Fraxel is a bunch of little dots instead of a big sheet. So it's like aerating your lawn. You're not ripping off your whole lawn, you're just taking little plugs. This is one treatment on a bite to the face. And again, just 1 treatment, a pretty significant difference from just 1 treatment. It's a medical condition called poikiloderma, but a lot of women will get this chicken neck and redness on the neck, and 1 treatment of Fraxel will improve that as well. This is one of my assistant's hands. That's 1 treatment. Makes it a little less rough. Again, the lighting's a little bit different between the 2 pictures, so you can't really see it completely. But here's even just the outside of the hand compared to there, and you see that there's significantly less wrinkling of the hand. This is a combination. We did a little bit of Restylane, and we did a Fraxel, and you can get a sense that the acne scars are better. And again, you might not see it in this lighting, but he had all these little lines as well here, and they're significantly improved with just 1 treatment of Fraxel and 1 Restylane. Maximus is radio frequency. Probably the first one that you may have heard of is something called Thermage. Then it went to Accent, then it went to So there's multiple radio frequency devices out there. Maximus is now the 3rd generation. It's a tripolar. The science is a little bit beyond this discussion, but it is relatively painless. It gets heat into the skin to stimulate collagen production and synthesis and fibroblast activity. So it really helps to tighten up skin, and that's its major benefit. Also works for fat and cellulite, which we'll show you in a minute, but it really is probably the best thing we have for tightening up the lower half of the face, especially the neck and jowls. Usually you need about 6 sessions done once a week, and then maintenance about 3 or 4 times a year. So again, don't know how well this shows up where you're sitting, but you get an idea of here how wrinkly the neck is looking, and then that's after treatment. I believe this was 6 sessions. Same thing here. This is a man's jaw or a man's chin and neck, and you can see that this double chin underneath, and the general appearance of the neck is significantly better with just a series of 6 sessions. This area drives people crazy, right? Underneath the eye, the bags, the looseness of skin. This is after 3 treatments, not a big difference. After 6 treatments, after 8 treatments, and again, anyone that wants to see these pictures in better lighting can talk to me after. I'll show you on the computer where it really shows up. But they're basically gone, completely gone. Concern about bat wings. Only treatment we had before that was surgical, and then you have a big long scar from your underarm down to your elbow. Not very appealing if you want to wear a sundress or an outfit that showed off your arms. And some patients get a very nice result with that as well. Fat and cellulite. Okay, you cannot get away from them. 80% of women will develop cellulite. It is a chronic disease. There is no one treatment that will work and work forever. Anyone that tells you otherwise is lying to you. And when we find the cure for it, it will be the holy grail of medicine, and everybody will love us. Okay, almost as good as the cure for cancer. So there is no substitute for diet and exercise. Certain people will notice a specific food will bother them, whether it's dairy, whether it's soy, whether it's tomatoes, whether it's gluten. Anything that inflames and irritates the body will irritate you at all levels. You forget that the skin is the largest organ in the body, and your general health and everything you put into your mouth is going to affect the skin. Okay? You cannot ingest whatever you want and not have it translate into your skin health, as well as your liver and your brain and your heart and your kidneys and your lungs. So, weight loss sounds like rocket science, but it's basically eat less and exercise. And there is no way around that one. Best way to keep weight off is exercise, because the body, believe it or not, will try to fatten you up again, and that's what drives people crazy. They work so hard, they lost the weight, they did a great job, and then they just find insidiously their body just wants to get fat again. And it's not your imagination, that's the way the brain chemistry works. We started as a nutrition and weight loss clinic, we do executive weight loss now, but the brain wants to put the fat back on because it's a protective mechanism in the jungles of Africa. Problem is, we don't live in the jungles of Africa anymore. We live in North America where there's food in abundance, so that starvation and protection mechanism is no longer a benefit. Instead, it's a disadvantage. So the radio frequency, in the old days we used to use mesotherapy to inject directly into the fat to try and break it down. Now a much less invasive technique is the Maximus, and it uses the same device that we use for the face, but it also combines a little bit of muscle stimulation to try and improve large areas of the body, such as the belly. So we've improved these lines here. There's your after. Cellulite, again, if you want to see a better version of the pictures, just talk to me after. So you can see more cellulite here and significantly less just with 6 treatments of Maximus. Now, you cannot do 6 treatments of Maximus, get rid of your cellulite, and think that they're gone forever. It's just like you can't go to the gym 1 week, think you worked out, and you're done until 2020. Okay? There's always maintenance. You can't eat 1 meal and live 30 years off of it. The body needs maintenance in every aspect. Water, food, exercise. Same thing here, right? You see there compared to there. Stretch marks are better, the whole size of the abdomen. As well here, look at the wrinkling and dimpling going on compared to after. IPL, okay, any questions about Maximus or weight, fat, and cellulite? It's usually the most common one, but okay. Yes? Sorry, I can't hear you. Cellulite treatment, usually we do it in a package. So ordinarily an individual treatment is $400. If you do a package, depends on how large the area is, it'll be between $1,200 to $1,800 for a package of 6 sessions. So, IPL has been around now for about 10 years. It's basically using a flash lamp, a light to zap things. And it works more on the surface as opposed to deeper lasers, which work to stimulate collagen. So it's used for age spots, little broken blood vessels on the face especially. It doesn't work as well for blood vessels on the legs. There's a very simple example. That's one treatment, right? People that come in with these little cherry spots all over their body, boom, gone. And that takes all of 5 seconds and it's gone for good. You will still develop new ones just because the body is always developing new ones. Cosmeceuticals, very useful. You know, vitamin C and E are chief components of the skin. Absolutely crucial, especially when you combine them with Fraxel or Maximus or any of the other procedures you're doing. Again, one thing is not better than the other. It's all a synergistic effect. For patients that have the hyperpigmentation, the melasma, the dark spots, whether it's from acne scars or pregnancy or a laser service gone bad, there's something called dermamalan, which is a combination of azelaic and kojic acids, and that works very nicely to improve the hyperpigmentation. Now when it comes to hyperpigmentation, it's very important to understand that they are very, very stubborn to treatment, and the treatment does usually require ongoing maintenance. So you might use the cream daily at the beginning for a month, then after the first month you go down to every other day, every third day, maybe once a week, but you will still need to keep on it for a long term. Hair removal. Now why is this in an anti-aging discussion? Because you gotta get it before the hair goes gray. Once the hair goes gray, we cannot treat it. And what a lot of people don't realize is bikini hair also goes gray. And when you tell a woman, oh my God, my bikini hair is gonna go gray? No, 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 that's just not acceptable. Then they wanna get it before the grays kick in, okay? Very important to deal with someone that knows how to use a laser. The unfortunate thing is, in Canada, there is no law as to who can buy a laser hair removal machine. Anyone can buy it. You can My kids can buy them with no training, no education. They get a one-day course with the company, and they are allowed to use laser on patients. So it's very important to understand that the person doing the treatment needs to understand the physics and the science behind the machine. Once again, patients will often call the office and say, well, what laser hair machine do you have? And the answer to that is, it doesn't matter what laser hair machine we have. It's a matter of the person administering the treatment. So you can have the greatest machine on the planet and a person that doesn't understand how to use it, and they'll burn you. Or you can have a machine that's 5 years old and still works beautifully because the person knows how to use that machine. Now, there's not really a lot of dark-skinned individuals here, but there is one that's a little on the dark side. And I don't know if you can see that. This is what happens when you go to someone that doesn't know how to use their laser. This woman came to me, 26 years old, very attractive young lady, cannot wear a mini skirt anymore or shorts in public because she was permanently burned when she went for laser hair removal. So those black streaks are burn marks from the laser. And this gives you another idea, right? So those lines are permanent. She's had them for 3 years. We've tried to get rid of them, and unfortunately we can't. So dark skin especially is prone to burning with laser, more so than white skin, but even white skin can have permanent effects from laser that's not done properly. So that's why we put that in this section. So I tried to be fairly brief, but cover most of the topics. I don't know if you have any specific questions about anything I talked about or questions that popped into your mind as we've gone through the session. Any questions?